Okay, awesome. Now that that's squared away, yeah, ABNI gone. I think it's been about a year now, but it's a process that we're still engaged in, where we're like holding kind of like these committee meetings to figure out what's going to happen with the space that was there, right? So there was that win, and also the inclusion of East Oakland in the statewide program called AB 617, which is a program that's seeking to reduce emissions in communities that have been identified as environmental justice communities. As in like there's a disproportionate amount of pollution occurring in these communities. And yeah, it's twofold, right? Like emissions on one level, kind of like addressing this like climate crisis. And then on the other end, kind of like, addressing the fact that like these local sources pollution are having an effect on local people. And then the other piece, is Oakland United, which is another campaign of ours and another sort of like, community committee space where people are affecting change in the construction of like an entirely new kind of residential / business area in the Coliseum area. Yeah, so a lot of history there to like unpack, a lot of things that have happened. But I think the real big thing to take away from that is kind of the work that the community is doing to ensure that there's like deep affordability. And yeah, so I mean, we're at 7:05 now. So I'll take a step back so we can move on. But thank you so much for being here, and definitely tap in with us if like any of the things that we brought up have kind of sparked your interest, you want to learn more, you want to tap in. Yeah, or also you're just like interested in building community and kind of like contributing to like the narrative and the discourse that we're having around like all these issues in our home. So yeah, thank you so much for listening. Thank you for being here. And I myself am very excited to hear more about Stop Oak Airport expansion.
Thanks, Gus. Thanks, CBE. Is it my turn to do a quick introduction? Can everyone hear me?
Yeah, we can hear you, and go for it, Ariella.
Okay, awesome. My name's Ariella. I'm on the steering committee of the Stop Oakland Airport Expansion Coalition. I'm really grateful to share this space with CBE tonight, and thank you for your work, CBE. Can I share some slides? Will I have permission to do that?
Yeah, you should be able to share screen.
Okay. Give me a second to work this out. Okay, can you see my screen?
Yeah.
Awesome. Okay, so our group has been together for 2 years now. We came together when we heard the news that the Oakland Airport is planning to add 16 gates in addition to the 29 existing gates. And we have the concern that more flights create more pollution, more noise, more global warming. And for the past 2 years, we've been talking about this and networking. We've got 60 supportive organizations signed on right now, also concerned about the development. And tonight, I'm grateful to have Debi Wagner speak to us about her community advocacy work. She's based in Seattle in the Sea-Tac Airport area. And for nearly 30 years, Debi has been really interested in understanding the impact of aviation emissions on health, welfare, and the environment. We have a lot to learn from her. To first create a local context for some of what Debi's going to discuss, here's a map of a 10-mile radius around the Oakland Airport. And I'm showing this just so we can start to think about who all is impacted by the traffic at the airport, by noise, by air pollution. And this is a lot of communities here. We're looking at Oakland, of course, Alameda, San Leandro, and as far away as Emeryville and parts of Hayward. It's not just the airport neighbors that are impacted by the airport. We also have to make the connection that when we're burning fossil fuels to fly, those fossil fuels, oil and gas, oil is getting refined in areas of the North Bay area. And if we are increasing traffic at the airport, that's increasing jet fuel refining and air pollution for communities that are near refineries. This little map shows that there is a pipeline that transports jet fuel from the refineries to the Oakland airport and then underneath the bay to the San Francisco airport. And Southwest Airlines, I have a little screen grab. Southwest Airlines has an energy partnership with Marathon Petroleum and Phillips 66. Marathon is in Martinez, Phillips 66 is in Rodeo. And we've got an incredible heat emergency right now all around the world. Heat domes impacting, I think 110 million Americans are experiencing dangerous heat levels right now. And it's hot in Europe and China. I think June was Earth's hottest on record. So when I think of the airport development, I worry about more flights and more global warming. And aviation accounts for 11% of Bay Area CO2 emissions right now. And aviation is different than other emission sources in that burning fossil fuels, burning jet fuel high up in the stratosphere creates more global warming than burning the same thing on the ground. So you have to actually multiply the CO2 by 2 to 3 times that to understand the total climate impact, the heating impact of flying. And it's a climate emergency. The world must cut emissions by 45% in less than 7 years to avoid complete climate disasters and chaos. And already we're starting to see that happen. So now's not the time to be expanding. And I want to close out my short intro before Debbie presents with some actions that you all can take. We have a petition that's hosted by the Sierra Club. Check that out at the coalition website, stopoakexpansion.org. The Port of Oakland issued the draft environmental impact report this past week. There's a 60-day comment period through September 15th. And please get involved with the coalition and participate in the community response, either by giving written comment or publicly speaking, or attending a rally that we're organizing. So with that, I'm going to stop sharing and pass it on to Debi Wagner.
Hi, everybody. Thank you for inviting me. And I really feel honored to be able to give this presentation. I just wanted to let you know I'm a citizen activist, but I've been on the UW Move Up team for the last maybe going on 6 years now. And I was initially put on the board. It's an advisory board as a member to give a community voice and feedback on the study. And the one thing that a lot of these studies do is they give you a lot of technical information about how they did it and what equipment they used and what the situation was like for topography and weather patterns and so forth. So I'm kind of skipping over that and just focusing on things that I think are important for us in our living environment near the airport. So this first slide, I'm sharing my screen. Can everybody see it?
Not yet.
Okay, let me go back and share screen and find it here. Okay, can you see it now?
It's coming. There we are.
Okay, so ultrafine particles are part of the particulate emissions that are regulated by EPA. But EPA regulates particles that are larger than PM2, the ultrafine particles. So they regulate PM10, which is 10 microns in diameter, and then 2.5. The ultrafine particles fall into a category well under the 2.5. So even though they are in the regulatory framework, they're not regulated because they don't have volume enough or mass or size to rise to the level of the regulation. But they are considered to be more dangerous than PM10 and PM2.5 because of certain abilities that they have. So I'm going to talk about what are the UFP and the discovery process, linking them to overhead aircraft, primarily landing aircraft, impacting a very large and densely populated area. And then I'll discuss what are the potential health effects of UFP and what are the observed health outcomes that we see in the areas that are overflown by these aircraft dropping the UFP on populations. And are there interventions that may help reduce the impact? So just to get an idea of the size of the ultrafine particle, it's the little dot on the blue dot on the hair. So you can't see it. It's microscopic. It's very, very small. And the interesting thing about the ultrafine particles from aviation sources is that they are the smallest fraction of the ultrafine particles. And I'll talk about that in a minute. There was a study done. First, it started at LAX, looking at the downwind area beyond the airport into the neighborhoods. So they have like a flow maybe similar to Oakland, where the aircraft are taking off over the water. But what they're sending back into the neighborhoods of the people that live near them, and when they're landing, is where the impacts are easy to find. So LAX, the study that was done, used a car with equipment that was actually from the UW group that I'm on the advisory board for. They used an automobile to drive through neighborhoods. And I don't know if you can see my cursor, but they did this sweeping pattern back and forth, looking at the ultrafine particles. And you can see how these are flowing with the aircraft arriving at LAX. The darker areas are the heavier concentrations of ultrafine particles. And so then another study was done subsequently to see if you could differentiate the particles by size. And what the team was able to find out, looking at Atlanta, Hartsfield, LAX, and another airport, was that they're uniquely small. So ground transportation typically produces ultrafine particles in the range of 35 to 100 nanometers in size. The ultrafines that are from aircraft are typically 10 to 20 nanometers. And I will add, a study I just read yesterday says that there's even smaller particles that aren't in the detection limits that seem to be a massive amount as well. But all of this is invisible, so you can't really tell from the naked eye. So as a result of that study, understanding that they could differentiate particles from sources by size, the UW put together the team and the Move Up group. Move Up is mobile observations of ultrafine particles. Put all the equipment into vehicles for Sea-Tac, drove the transects, found very similar impacts, but a couple of things that were unique from knowing that the Riley study showed there were different size particles from aviation compared to ground transportation, is now you could go into the flight paths and you could separate them out. So you could see what was being deposited from aircraft and know which one was which, whenever you, I've been discussing these things with the industry for 30 years. And the excuse has always been, well, you can't prove it's us. Cars, trucks, buses, everything produces particles. So now we can differentiate by size. So the unique thing that was discovered was we put equipment on the ground and turned it on to see what would happen when an aircraft flew directly over the equipment. And there was a little delay, but then the equipment measured a large spike just seconds after the aircraft passed over. So the theory on the part of the doctors from the UW that were working on this is that the vortex from the engines are bringing down a direct ground level impact of what's coming right out of the engines. And it's showing up in these spikes each time an aircraft passes. And they could also hear the vortex as the aircraft went by, sort of a noise. And you could actually see it too on the ground, whipping the grass. So that was an interesting observation I thought I would share with you. So these are the aircraft passing over and the vehicle driving through the transects. And you can see the particle emissions in the bright yellow of the size that they're looking for to identify aircraft sourced ground level impact is happening for quite a distance from the airport. This represents about a 10-mile area. So the impacts are not local near the airport necessarily. If you're in a flight path, even 10 miles away from the airport, a landing aircraft could be depositing these ultrafine particles onto you. So there is another analysis that the UW ran, which is a principal component analysis using black carbon. They learned that the black carbon from automobile traffic is different than the black carbon coming from aviation. So they were able to calculate a method to determine another source based on black carbon, not just the size of the ultrafine, but also the presence of black carbon. So these uniquely small particles are not normally observed in the environment. They are so small that they are very unusual. So other sources don't necessarily produce this size of particles. And they exhibit some behaviors that are unique for their size. Because of their small size, they can infiltrate very deep into the lungs, into the deepest part of the alveoli, cross the membrane barrier, enter the bloodstream. They can potentially affect all organs and body systems. Dr. Larson, who's one of the Move Up team, also made it clear that there's potential for it to pass up the olfactory nerve directly into the brain from breathing them. So maybe this wouldn't be so terrible, except for the fact that some research points to metals and toxics and aerosols and unburned fuel and other things on a flat surface that these ultrafines could be carrying deep into our body systems. So this is one of the reasons why they're considered to be more dangerous, is they have a flat surface, they're uniquely small, and they have the ability to pass through normal protective things that our body does to weed them out. So in other words, if you're exercising and you're breathing larger particles, they don't go that deep. and you can expirate them out. These are very difficult to do that with. Then we also learned from Boston studies that these particles are small enough to enter our homes. So the research that was done there and elsewhere shows that the particulate can be inhaled in fumes. It makes it across the lung barrier and goes into the circulatory system. So to get an idea of the amount and rate of ultrafine particles that are in our communities and entering into our homes, we did a field test of ultrafine particles with mobile equipment that we could take to a park that was near the airport. And what was observed was when the aircraft were going over us to land, so they're coming in, not takeoffs, but landings, we were getting readings of 60,000 parts of UFP per centimeter cubed. That's equivalent to and greater than standing on a freeway. And again, freeways producing the larger particles. These are the tiny particles that are more dangerous. When the wind shifted while we were there in the park, it dropped to 20 to 30,000 particles per centimeter cubed, which is more like an urban background, like a city street. Next to the airport terminal, the reading was 117,000 particles per centimeter cubed. That was outside in an area of public access. And you would expect that kind of thing to cause anybody with asthma or existing respiratory problems an acute response. So that level, that 117,000 was very equal to what was found at Copenhagen when they did a similar analysis around the tarmac. 4,500 was the amount that was inside the terminal. So the concerning thing about this, especially for people that are concerned about justice issues and workplace environment and things like that, is that people aren't even aware of this. So they don't even know to take precautions. And people that are working at the airfield are exposed to this tremendous impact on a really regular basis. The health effects of this kind of exposures have not been studied, but there's plenty of this rate of exposure. Some health studies have been done looking at the types of things that might occur as a result of exposure to ultrafines. But looking at airport workers, there's anecdotal information from the past around Sea-Tac of how poor the health was of the airport workers and lots of complaints. This is the Copenhagen airport, and you can see these higher ranges of the ultrafine particles per centimeter cubed is in the terminal areas here, similar to what we found around Sea-Tac. So this is more than double what you would have as exposure if you were standing on a freeway. I had asked the team to give us an idea of the area of impact. So this is the area of a modeled plume of ultrafine particles. So this area encompasses about 670,000 people who live there. Ultrafine particles are not regulated like larger particles, but are considered to be extremely dangerous. They're associated with asthma, allergies, respiratory disease, heart attacks, strokes, and cancer. So I noticed this is from an EPA website, and I noticed they said here, or not EPA, I'm sorry, I shouldn't source this. A series of studies commissioned by airport officials and conducted by third-party researchers in the past decade has gradually uncovered that air quality around LAX was not much different from the air quality generally in the region, except for one area of concern, ultrafine particles. So this is basically a propaganda statement that you'll see and hear a lot. Because these airports are not just producing particle emissions, they're producing thousands of tons of criteria and toxic emissions, but they're not regulated. So they don't show up as sources. They don't show up in any regulatory analysis. They don't, they don't have to report and scrub out emissions like other industries. And their emissions are much, much higher than other industries there compared to incinerators, refineries, steel mills. So, and this is kind of an off topic a little bit. I wanted to make people aware that there are multiple impact, multiple item impacts happening to us simultaneously. So we're exposed to dangerous levels of noise and at the same time, dangerous levels of emissions. And these are some of the health consequences of being exposed to those two. There are overlapping effects with heart, brain health, metabolic, and other stress, sociological, and so forth. This was a study recently done linking ultrafine particles with brain cancer. And in the past, we've had very high rates of brain cancer around Sea-Tac Airport. These are some headlines for different types of effects of ultrafine particles, studies that have been done. And then for the first time, an air study detected these nanoparticles in children's urine. So it's giving you an idea, passing into the body through the systems and showing up in the urine. This is a statement, a couple statements here. The LAX airport detected it in a broad swath of densely populated communities up to 10 miles from the runways, the ultrafine particle plumes in amounts about equal in magnitude to those from a large portion of the county's freeways. These findings at LAX that kicked off our studies and other studies were alarming and raised serious health concerns. So one of the things the UW team did was people that had mild asthma walk in a flight path, and they had an observed increase in inflammatory blood markers and a reduction in lung function just from walking around in an area overflown by landing aircraft. So the next obvious question for me was, what are the health impacts that are going on underneath the plume? So I showed you that first plume, it's in this area right here. And the second plume to the south was actually more elongated and longer. So our King County Department of Public Health received funds from our state of Washington budget to look at the health status of the people living under the plume to try to determine what was going on with them, see if there were any noticeable impacts that they could discern. 670,000 people are living in the plume area in the 10-mile. Nearly 1/4 of the county's 2.3 million people population is potentially affected. An exam of US airports found that approximately 10% of the total US population is living within 10 miles of a commercial airport. That's 33 million people potentially affected. Another look at this too also found that our population that is impacted around Sea-Tac and many other airports, I'm sure, are predominantly low income and minority residents. So the health status in the plume is a greater percentage of infants born prematurely, higher hospitalization rates for asthma, stroke, chronic COPD, diabetes, heart disease, lower life expectancy, higher rates of death overall, as well as death from heart disease, unintentional injury, chronic lower respiratory disease, diabetes, chronic liver disease, and homicide. So you've got the stressors of the noise going on, and you've got the debilitating health, may cause people to act out at some point. Higher hospitalization rates, the rates of poor health outcomes were worse the closer you got to the airport. They were sicker the closer they got. And this was the study looking at the impact of the ultrafine particles indoors, how much is infiltrating inside. And these were also the tiniest particles that are getting in. So they've observed also, there are studies that have been done that show a preterm birth is much higher in these impacted areas. Also, low birth weight babies are much more prevalent. Additionally, there's a noise study that was done around Newark, looking at the way the rates went up for low birth weight as soon as next gen flight paths were introduced. And this is a King County health map showing infant mortality is kind of off the charts here for the area of the South Plume. That would be the one that is most affected by noise and the elongated plume from the ultrafine particles. So one thing that has been done as a result of the UW studies is, hang on. So they've put some air purifiers into residences and noticed that the 50 to 70% of the infiltration rate of the ultrafine particles was reduced by 75 to 82%. I also know from another study that was done in California, I think it was around LA, was looking at school performance that improved a lot as a result of better air quality in the classrooms. So we have extremely poor educational outcomes as well in our communities. And it's all these measures that I read to you are in the significant range. So in other words, if you're looking for health disparities, you look for things that become statistically significant. In other words, it's so much worse than the average that it's now considered a big problem. So we were so much worse off than the average in the greater metropolitan area that they are continuing to look at more closely some of these markers, doing an asthma study, looking at interventions and maybe more information to the public about access to mitigation and other things. So, yeah, that was about how much they were finding inside the classroom. There's some next steps, and I think I've gone over a little bit. So I just wanted to share with you guys, after looking a little bit about your EIR, just wanted to share some of this data with you. So there were an analysis done by EPA on emissions at Sea-Tac in 2014. EPA also did it for 2017. And you can see that just for sulfur, it's more than doubled in just those few years. So the sulfur rates coming just from aircraft have nearly doubled. And sulfur from Sea-Tac Airport is the highest emitter of sulfur in our county of over 2 million people. And it surpasses all cars. So what I had EPA do when I found out that they ran an emission inventory for all airports in the US, all commercial airports, every 3 years in the US was I asked them to do a comparative of figures from aircraft, just for instance, that the Port of Seattle had provided for Sea-Tac Airport in a preliminary draft. So here you can see a direct comparison in short tons of pollution between what the airport consultant reported were the emissions of nitrogen oxides at 1,623 tons. That's for a year. And what EPA had gotten using the same model, same FAA data on numbers of operations, they got a completely different figure. So I have since made a complaint to EPA about falsified data. And this draft that I was using to get information that was being provided by consultants working for our airport was all withdrawn and somewhat scrubbed from the record. But just for curiosity for this example, I thought I would look up the sulfur inventory for the state of Washington, and I can see here in King County, airports are producing 523 tons per year compared to other sources. There's vehicles, on-road mobile, and trucks. So you can see what a huge inventory this is. Now there's a glass recycler near in the Georgetown area, which is part of the 10-mile radius. That glass recycler is producing quite a bit of sulfur, and they're trying to shut it down, but it's still only half the rate of Sea-Tac. So I just wanted to share that with you guys because you're doing an analysis of your environmental impact report. And that report was written for the airport, of the airport, by the airport, not for you. And the emissions that were used could likely not be accurate because they need to comply with the Clean Air Act, even though there's no local regulatory control over airport emissions. As far as aircraft are concerned, they still have to comply to EPA's Clean Air Act rules. And in my experience, no commercial airport that's adding the number of aircraft yours is adding will comply. That's the end of my presentation.
Thanks, Debbie. If you have time, can we open it up to questions?
Sure.
Go ahead, David.
Yeah, I was wondering, you say EPA does not regulate the ultrafine particles. Do you know why that is, given, you know, their toxic effect?
Well, so this is kind of a new science. 2014 is pretty recent history to be able to discover these ultrafines and that they're having this large of a ground level impact. EPA usually takes an awful long time to create any new federal standard. And the way that particles are regulated right now, like I was saying, it takes a mass. So picture a clump of soot or particles. It takes a mass. And with ultrafines, you're never going to get that. You're just not. They're so small that they're not going to make a mass big enough to ever be part of a regulatory framework when it comes to mass. So they have to create a new method for measurement that, as well as a new standard. And it takes EPA forever to do that. We're talking 10 years from 2014.
That relates to another thought I had as I was listening, and that is you were talking about 60 and 70,000 for cubic centimeter. A cubic centimeter is really quite small. I mean, it isn't tiny, But
Yes,
I think, we all have a pretty good idea what a centimeter is. It's, some fraction,
yeah.
decent
It's
fraction of an inch.
right. It's a really large amount, and keep in mind that half of this or more is getting right into our homes. Even though it can't be seen, your air is dense with these particles.
It must be. I mean, it's hard to imagine, it's hard, at least for me, to imagine 70,000 of anything in a cubic centimeter.
Yeah, the machine actually freaked out when we went to the airport. It just
Okay.
kind of went into freak out mode, and the UW researcher had a hard time getting it to calm down because it just never
Gotcha.
measured anything like that.
I think Merle Adler had a hand up.
Yeah, I'm not representing or trying to speak on behalf of 350 Aviation up here in Seattle with Debbie.
Yeah, hi, Merle. Hi.
Hi, Debbie. What's
Yeah.
going on?
Climate,
Very nice
climate's another big can of worms that we're not opening up that barrel today, but yeah, it's a big problem for aviation.
Very great presentation. The regulatory part of it is kind of fascinating from our perspective up here. Really, they're attempting to go more of the judicial route towards suing Delta, who has a hub here, and Alaska, and the port itself, which is the entity that kind of overrules transportation in the Puget Sound area. But one thing that happened that points out some of the regulatory hurdles that you have is that when they discovered how much, they did a secondary study to the MUAT study, when they discovered how much of this particle matter was infecting schoolroom where children are, they did this study that Debbie recommended that showed that air filters would remove 85% of the particulate matter. But what I think is overlooked here is that the politicians in that very instance kind of dodged the whole issue by way of taking money from expansion funds that weren't supposed to be touched for mitigation because they don't allow to put in additional sound deadening things into from these federal funds. But they took that money almost immediately and applied it to these school children getting infected by this learning performance debilitating and ultrafine particles. Now, as to the court case that we have coming up here, there's a very successful lawsuit, class action lawsuit firm up here that's stationed in the area here that's, scored 500 billion in lawsuits around the areas of the country, and that they are pursuing it and looking at it as being a extrapolation of the fact that we have 100 excess deaths from people located within a 5-mile radius of the airport, and the other aspect is that within a 10-mile radius, which is where I am from some of these runways, you have people who live just outside of that 10-mile radius in a very rich neighborhood called Laurelhurst, who have an 85-year average life expectancy, whereas around the airport it's a 71 to 72 average life expectancy. These disproportionate impacts, I think, can be proven in court. And, you get people like Adam Smith, who in a recent forum that we had was complaining that, well, we can't even figure out whether this is really truly associated with pollution from the airport. We don't know what it really does. But, on the other hand, they're trying to, ameliorate these problems against our school children. Politicalization of the process.
I got a couple things to add, Merle, that maybe you were aware of, or I'm not sure, but the excess death rate around Sea-Tac Airport is the same figure as the COVID pandemic that caused a global emergency. It's a 1.4% excess death rate. So it's interesting to me that absolutely nobody is panicking over that fact. So it's almost as if it's considered, you know, you're expendable. And that should not be the case at all.
Well, we're trying to extend that radius that they're operating on out to my neighborhood, which is the richest in the city. But
Yeah.
but the
You've got this major polluter, this major polluter, and you've got people living near it. And now you've got sick people and people dying too often, too early. It doesn't take a rocket scientist to figure out that there's a relationship there.
yeah, I've been in the next generation flight path for over 40 years. And I just recently in April have shown that I have a lung mass in my right lung. And I also have had a pacemaker put in here within the past 4 or 5 years. But I think it's personally effective. And I think we need to measure the people who are heaviest impacted by this, which is rather right over the flight paths.
Yeah. Well, we're working on it. Thanks, Merle. Good to see you.
I think Rochelle Towers had your hand up next.
Hi, thanks. I was also thinking about the workers who are exposed outside on the tarmac and how those relations and that issue was dealt with in Seattle, where where did the unions stand? I know probably
Yeah.
not the answer to that question.
Yeah, I think, did we talk about this, Ariella, with Rochelle before? Because there's no action and the unions don't seem to be interested. So, you know, it's hard to get, you have to make a connection with somebody. I was thinking so much about this when you were talking about the political climate that you're in right now. You really kind of have to make a connection with somebody for them to really listen to what your life experience is. Your lived experience is really, you know, it's so important to this process because people are suffering. And how else do you talk to people other than just say, this is a bad situation? I mean, how bad does it need to be that the lead from general aviation is producing blood lead levels in children near general aviation airports at the same rate of Flint, Michigan, but yet nobody is reacting? And now in the reauthorization bill, FAA actually slipped in something to keep them from having airports convert to unleaded aviation gas. And it's amazing to me that people aren't outraged. I mean, people need to have this, like, I don't know. They need to have outrage about how could you do this to us? And why are you doing this to us? And how can this happen? You know, it's amazing.
I want to emphasize what you just said, Debbie, in case people missed it. There is leaded avgas, aviation gas, still used at the Oakland airport for the propeller planes that are using the north runway.
And study after study has shown that there's no safe level of lead for children or for anybody for that matter. There's no safe level. And general aviation airports in the US are now currently the largest airborne source of lead emissions in the country. But yet EPA has dragged their feet on this issue for the last 30 years I've been involved. Every time that this issue has come up, EPA has dragged their feet on it. And now FAA has stalled out certification of various fuels that could replace the leaded fuel. Airports have trouble getting the equipment that they need to store and dispense the fuel, the unleaded. And now, they're just saying that they can't even do it. FAA is in their reauthorization. It's crazy to me.
We've
There's an
got 7
interesting-
minutes left. I want to hear Doreen's question, if it can be brief, hopefully, and then Jack's question.
Hi, Debbie, thank you. I've heard you so many times. Thanks, Ariella, for putting this on. Debbie, I've heard you talk so many times. I stand in awe of your work and your dedication and heartbreak that goes
Thank
with
you.
that.
I'm humble, though. I'm just like all of you. I mean, I'm no different. I just gathered this information and I'm happy to share it whenever I
Thank you.
can.
Thank you. And you had said something about the leaded avgas, like people don't know and aren't outraged. Until I was subjected to a flight shift in targeting, I didn't know. And I've just kind of always been raised, everything causes cancer. Everything's bad for you. Everything's going to hurt you. I had no idea until I found myself really sick and in the hospital a lot. And then started digging in, you and Mickey, listening to you guys and following what you write.
Yeah, Mickey Barnes
Anyways.
is great. Yeah.
She is, she's phenomenal. My question is, I have found a lot of misinformation, like you were pointing out, the data is wrong. And they
Right.
just put out what they want. And I can't
Right.
figure out, they publish that they have 120,000 flights a year to over 200,000 flights a year or operations. How would you ever be willing to give a workshop to those of us struggling through paperwork, trying to find truths? Like, how do we find those? Especially when you have a county, a city, and an airport hiding numbers and data. And I don't think I'm alone, though I know all airports are different.
Well, it depends on how you want to fight the EIR. I mean, do you want to do it with public sentiment? Do you, a lot of people are going to say, well, not in my backyard. I don't mind that it's over there on you, but don't put it near me. And it's a level of disinterest. Public information campaign, though, like saying, our lead levels are similar to the blood lead levels found in Flint, Michigan. And that was a national crisis. I mean, everybody was very concerned and upset about it. I think it's because our issues, like the rate of death, is similar to the pandemic. Why don't we get the attention and the focus? And I think people are afraid because if it's not here, then it might be there. Maybe they'll move it, or maybe it'll have to change people's habits about going on vacation or flying to an exotic place. I don't know who does that. I don't do it, but a lot of people do. And if you take away that love, that romance that people have with flying, I think it's too much.
Well, and I think
The other option, like you asked, is looking at the data. And the model data input is not open and subject to scrutiny. I would start asking for that if you're serious about looking at the data, because FAA is controlling that with their consultants and airports. And I got the data from the third runway EIS, and it was all wrong. It was all truncated. It was all false.
Right, I'm running into the same thing, and everyone that I ask, they just won't answer my email. Or if they do, well, that's the number we have. Or, the EPA says, well, that's what they never filed this year, so that's what we have on file, and that's what we rolled forward. Or, I'm not getting answers, and I know I'm not alone there.
Well, I can walk you through a couple of things that may be really helpful. EPA provides airport emission data from running the model every 3 years. They didn't do it in 2020, so they would have 2021. So you could have a comparative to maybe if, your airport EIR used 2021 as a base year, which they may have. It's going to be, comparing apples to apples. And when you see
and I've looked at that. Sorry, I was going to keep it a quick question. Maybe we'll talk another time. But so our operations went from 120,000 to over 200,000, but we only have 200 or it was 250 or 350 pounds more lead. we're running more operations in Reed Hillview during
I
their
want to
study.
cut
which
you
has
short, Doreen, because I want to
substantially
hear Jack's question. Can you
Yep,
guys
yep,
take it offline? And
Yes, we will.
I'm so glad
Thank
you're
you.
connecting.
Yeah, well, we're out of time, but I guess my question was about how do you know that the increased health impacts in these are the people that are in the flyover zones are from the airplanes as opposed to just being like a low income community? Did you try to sort all that out? And if you did, that would be great, because that would be very much the situation we have here in Oakland.
So that would be a next step. So we always have gaps, questions that we need answered. So we're looking more closely right now at asthma, but the gap studies have been really important. And that's a very important one that you're asking. There's no epidemiological body of work that I could refer you to. As far as looking at a population, you have to, for an epidemiological study that's usually millions of dollars. You look at that person, their lifestyle, their history, their genetics, their medical, checkup status, all that kind of thing, to try to determine whether or not their illness is from environment or from something else. And we're not there yet. We're trying to get there, but we're not quite there yet.
Yeah, well,
Thank
thanks for
you
a great
so much.
presentation. Really enjoyed it. Thank you.
Yeah,
Yeah.
thanks.
Thank you so much, Debbie, again for joining us and sharing your expertise. I hear you that you are a community member like us, but also appreciate you so much for joining us and sharing what you know and even, some brief strategies that we can take as we look at the draft EIR for the Oakland Airport.
Yeah.
I really appreciate you joining us.
Just to let you know, I'm sorry. I just wanted to say I've done an awful lot of work in my local area on EJ. And I've been through EPA trainings on EJ, and I have a good slide presentation on environmental justice when it comes to airport impacts. If you'd like to see that, I can send it to you.